Thank you for joining us. My name is Lacey Brown. I'm a gerontologist with South Dakota State University Extension. My presenter is Teresa Guerin Grubbs. She is with the College of Nursing at SDSU. Advanced care planning discussions are among the most difficult your family will have. During this video, we will define difficult conversations and provide examples, describe the process for having difficult conversations about advanced care planning, and identify strategies to help you with these conversations. Individuals and families must reflect on what happens if a member or loved one is suddenly faced with a crisis medical situation and they do not have decisional capacity. Decisional capacity refers to a person's ability to understand current health situation resulting from an unexpected health event, as well as the trade-offs and benefits associated with any treatment. Advanced care planning is a process which includes evaluating one's own values and what matters most in life, documenting our wishes related to healthcare decisions, having conversations with important people in our life, including our loved ones and healthcare providers, and revisiting our values as we experience different life events. Advanced care planning is about how we want to live. Remember, this is a process and each piece is equally important. This is not something a person does in one day, files away, and never thinks about again. Advanced care planning should occur in advance or before a health care crisis rather than during a crisis. It's important to understand how advanced care planning is different from long-term care planning. Long-term care refers to people who need help with routine tasks, meal preparation, laundry, cleaning. Advanced care planning is more likely to involve specific types of medical care or treatment that a person would receive in a serious medical emergency. To those who participate in advanced care planning are 3 times more likely to have their wishes for end of life known and followed. This leads to less anxiety for patients, families, and healthcare providers because everyone knows the patient's wishes and works together to ensure the care aligns with those wishes. In a survey completed by the Conversation Project, over 90% of people said it's important to talk about the end of life with their loved ones, yet only 1 in 3 have actually had the conversation. Advanced care planning involves very difficult topics for many of us to speak about, including talking about making decisions about the life or death of someone very close to us. If you're unable to make your own healthcare decisions, your healthcare agent will need to make these decisions. So some examples of difficult medical decisions involve artificial nutrition, a ventilator for breathing support. We've heard a lot about that one lately with COVID-19. Starting dialysis because the kidneys are failing. But there are other difficult conversations that families may have to have. For example, encouraging a loved one to stop driving, encouraging a loved one to get help for those routine chores, or asking a loved one to move closer to us so that we can help support them.
Thank you, Lacey, for that overview of advanced care planning and how it's different than long-term care planning. Now we will discuss the details of the advanced care planning process. Having advanced care planning conversations with your family, loved ones, and healthcare providers can be looked at as a 3-step approach using the 3 Ds: deciding, documenting, and determining. Each of these steps will be discussed in more detail. Before having a conversation with your family and healthcare providers, it is important to decide what healthcare decisions you would want if you were unable to make the decisions for yourself. For example, if your heart stopped beating, would you want the healthcare team to attempt cardiopulmonary resuscitation, which is also known as CPR, to try to get your heart restarted, or would you rather be kept comfortable? When deciding your own wishes, think about what is important to you and your quality of life. Some questions that may help to evaluate your own wishes are: what does a good day look like to me? And what matters to me through the end of life? Once you know what decisions you would want for yourself, it is important to write this information down in the form of an advance directive. This is a legal document which can be used to guide your healthcare should you be unable to speak for yourself or make your own decisions. Once you have decided what your wishes are and have documented these wishes, the next step is determining who you would need to share these wishes with. Most people share this information with those closest to them, such as a spouse, children, and siblings. It is important to have these conversations with your healthcare provider as well. Do not delay. It is important to pick a time and a place to have these conversations with loved ones. Some choose to have this conversation surrounding life events such as the birth of a child, when you are in good health, or after the death of a loved one or a friend. Around the holidays, when families are together, is a great time to have these conversations as the family is already together and you can discuss your wishes. When preparing for these conversations, it may help to write a few things down. This includes some key points to help you remember what you might want to say. You may also choose to write a letter to your loved ones and then share the letter with them. It can also help to practice having this conversation with a supportive friend before then speaking with family members. Everyone is different and feels comfortable using different words. Some ways to get started include, I've been thinking about what happened to a friend or family member, and it made me realize, and you can discuss your wishes. You may also say, I'm glad we are here as a family because I would like to talk about my health and what I would want if my health changed.
When having the conversation, remember that these can be difficult things for your family to hear. Provide time for them to think and reflect. These conversations should happen more than once over our entire life. It's not necessary to cover all advanced care planning at once. It's best to take it in steps. During this video, we discussed the importance of talking about your healthcare wishes, the steps to take prior to having the conversation, and tips for successful conversations with your loved ones. We hope you feel more prepared to have these conversations with your family. And Teresa and I really encourage you to act immediately on getting your advanced care plan put together. We are grateful for your time today. Teresa and I are available to you. Here is our contact information on the screen. Please feel free to reach out to us.